Hi everyone, today we're doing a video on how to do a proper LVAD dressing. So first you want the patient to lay down somewhere, a bed, a couch, somewhere quiet where no kids are going to be bumping into you or the patient, no animals, no cats or dogs are going to be bumping in. You want to have at least a sterile field as clean as possible. So once you are all settled with your patient and you turn on some TV, favorite TV show, Grey's Anatomy, or some sci-fi or mystery movie, relax because this is your show. So the first thing you want to do is to prep your field where you're going to be doing the dressing change at. Clean it off. If it's going to be a nightstand or some other table, first clean it off with some Lysol. Get it nice and clean so you have, again, the best sterile field as possible. Okay, you want to throw that away then. I recommend having a trash can by you just so you keep your sterile field clean. Once that's dry, you want to go over to the sink, okay? You want to wash your hands, sing happy birthday twice, sing it nice, loud and proud. After that, you want to take some disposable paper towels and dry your hands up and away to your fingertips. Throw that towel away. You don't want to use any cloth towels, bathroom towels, because that can collect germs. Next thing to do is open up your kit. I'm going to show you how to do the Sorbaview kit on the lovely Annie that we have, but I will also show you when to open the Primapore dressing. So you can open the kit, there's two ways. You can open it up like a bag of chips or like an envelope for the white little folds here. So I'm going to do the bag of chips way and take all my stuff out of this kit. Okay, bag, throw it away. First things first, you want to cover up, put a mask and hat on your patient. They need to be covered, and you will put a mask and hat on your patient. For the ladies, you might want to pull your hair back. Okay. Okay, hair's all tucked in, mask is on, you're ready to go. So, you want to put on your sterile gloves. And the video that you just saw prior, this is what you'll watch to put the sterile gloves on. Again, opening the gloves up, do your dominant hand first. And then non-dominant hand. Okay, pick up in the center, throw away. It comes with this adhesive dressing remover. You will open this up and this will help take off the dressing that's on the patient now. Again, throw it away. This just helps remove the dressing from the skin. You just want to dab it, get it all nice and wet to help with the pain for the patient. Okay. There are two ways to take off the pants. We will talk about that a little later. There is a slit at the bottom, which you could rip that and go up, or you could take off the full pants. I'm going to use the slit and just rip up. Okay. Then you want to take off the shirt, this sort of the same way. See, this is why the adhesive remover helps, because it is a little sticky. Okay, Okay, you want to take it all off. And everything comes off. Again, throw it away. With the anchor, so you have the boy and girl here. You want to pull apart and pull up. The girl goes through the boy. And then we'll come out the other side. You'll lay the drive line down and take the old anchor off as well. Again, very sticky, but after a week, it will be easier to take off. So after that is done, you're going to take off your sterile gloves and throw them in the trash. At this point, you're going to have to go wash your hands again in the sink. Okay, so we're going back to the sink. We're going to sing happy birthday again, do it twice, sing loud, sing proud, and then after that, you're going to have to use the disposable paper towels again, dry up to your fingertips, okay, and throw it away. Again, no cloth towels. So you have the white packet now. This is going to, you'll have to open it up like a storybook, one way towards you, away from you, and lay it nice and flat. Okay? This is going to be a key part of trying to keep your area sterile. This is also the part where you could lay the Primapore on. So you want to open it up again like a storybook, and just lay it down on the white. Okay? If you use the Primapore, this is the time. Again, you'll put on some sterile gloves. If you need to know how to put the sterile gloves on, you could re-watch the sterile glove video. Again, open it up like a storybook. Dominant hand first, palm up. Just ease your fingers in. You could use the, touch the glove that isn't on yet with the glove that you have on to help ease that glove into your hand. Pick from the middle, throw away. So you have this packet now, and it reads from left to right, very how you would do the steps. You want to open this up. And again, I will show you for video purposes, but this is how it should lay. That what should be in your packet. First things first, you'll take the chlorhexidine swabs, break the wings, you'll hear a little snap. You want to rotate or bring the sponge down to make sure all that medication and fluid gets in there. You'll see a different coloration in the sponge, and that's when you know that that chlorhexadine's in that sponge. You want to press down right where that driveline exit site is. Hold for about 10 seconds, and then you want to do circles. Rotating circles, it doesn't matter, clockwise, counterclockwise, just keep rotating outwards. You don't want to bring it back in, because you would bring all that bacteria back into that driveline, and we don't want that. Okay? Once it's all out, throw it away in your trash can. You're gonna wait for it to be dry. You don't want to use a fan You don't want to use your hand, any paper products, because obviously you're sterile, so you shouldn't be touching anything anyway. And you want it to air dry. At this time, this is a good time that you could check for any redness, swelling, drainage. Ask your loved one how they're doing, if they feel pain or anything like that. Okay? So once it's fully dry, round number 2. Again, you want to snap it, the wings in place, rotate down to make sure all the liquid, the chlorhexidine, gets into the sponge. You see the discoloration, different colors, and again, press down straight to that driveline exit site. Hold for about 10 seconds, and again, rotate out, doesn't matter, clockwise, counterclockwise, just keep going outwards to get all that bacteria and clean it away. Throw away. Wait for that to dry. Next up, once the site is fully dry off the mannequin, you will want to take this protective super prep wipe. This helps have the dressing stick for the week that you should be having the dressing on. For our purposes here, we are not going to be doing it on the Annie because it will be really difficult to get off, but I will show you how to do it. Again, it is just a sort of a 4x4 little swab. You want to do the border where the dressing would be placed, okay? Just the border to help it stick. And again, you do this only when the chlorhexidine is completely dry on the skin. Throw away. Next up, we have the Silverlon. And this Silverlon is activated by this alcohol prep. So you want to open these two. Open them up on your sterile field. Just dump it right in this blue cloth. Okay? And then you want to open the alcohol. And how it activates is just, and again, for video purposes, I will show you up close. You want to just place the alcohol and dab it on the white Silverlon. This activates the silver here. Okay, so just dab. And then once you see that the skin of the patient, it's all dry and ready to go, you place this Silverlon right at the driveline exit site. You can remember silver to skin, okay? The white should always be facing the outside. So we're just gonna place it right here, just like that, okay? Again, garbage. Now the Primapore people, this is where you will place the Primapore dressing after the Silverlon is in place. You still have to put the Silverlon on. For the Primapore, one end, other, and you fold it across. And just lay it down, okay? That is it for the Primapore. For the Sorbaview, which most of our patients do use, you have the shirt and pants. Like I said, I would come back to talking about the shirt and pants, okay? Shirt, it has a little window. You want to try to line up that window with that Silverlon dressing so we can see that on the outside. There's two flaps to open up the Silverlon. My preference is to sort of line up the window with that Silverlon on, press down and go up. Make sure that top is all flat and good on the patient. And then line up the bottom with the driveline. Press down. So now you have the shirt on. To put the pants on, you're going to be like Steve Urkel. You're going to pull the pants all the way up to the shirt. Okay, you're going to go under the drive line and pull those pants all the way up. Again, it has 2 flaps to open it. So, Steve Urkel pants, pulling all the way up to the shirt, and you will press and open those pants to press down on that shirt. Okay, Sorbaview, people, that is it for that dressing. But for everyone, the last but not least is the anchor, the most important thing besides the dressing. You want to put this anchor on to avoid any infections, pulling. Everyone should be putting their anchor on. What you could do to put the anchor on, it's patient's preference where they want it on them, but you put the anchor down first. Again, there's 2 wings and flaps to put it on their skin. Place it on their skin, just down, like that. Throw away. And then you want to place the anchor, the drive line, right on top of that anchor. Again, you have a boy and you have a girl. You want to pull up and away so that girl goes through that boy, and then pull tight so they are touching hands. And that is it, everyone. We did the Sorbaview dressing. Please, if you have any questions, give us a call. You guys are done. You can take the mask off, the head off, and that is it. Thank you, everyone.